we're now talking about preventative medicine as well.
Yeah.
Regenerative medicine is really looking into how you can use biologics or different materials to repair cartilage, or different cell therapies to increase height in your disc space. And there's some really exciting companies in this space. You have Vericel, which have that's an autologous cartilage repair. What they'll do is they'll take some of the patient's cartilage, they'll process it through their facility in Boston. I think it's Boston, definitely Massachusetts. But they'll process it, and then what they'll do is they'll be able to re-implant that back into the patient, so they have their own cartilage to repair certain knee injuries. There's other companies that have got really fantastic options again in this cartilage repair space, and it seems to be getting quite competitive. And when you
Yes.
see, I think there was 4 or 5 companies that are pre-commercial, you know
And
you're in the right way, in the right place.
right, I actually invested in Nanocom. Um,
Okay.
yeah, and I also know Cytex Ortho as well. They are both of them are actually Pitch 3D startups, so I monitor
Yeah.
them very closely and hope them succeed in the space. They have very similar but pretty unique approach. So I'm just hoping one of them can get to the market soon.
Well, I think I honestly speaking, I don't know too much about Nanocon. Nanocon were actually presenting at Canaccord, so that's one of the companies that was presenting.
Yeah,
Cytex didn't present, but Brad Estes was there in
yeah,
attendance.
yeah,
Um, so what I like about Cytex, they've gone about it in a really good way in terms of their funding. So far, I don't know whether they have any external investment, and I don't know how right I am to mention this, but I believe they've all their money's come through grants. I think they've
yes,
raised up to like $20 million in grant funding. It's
yeah,
impressive what they've done. Of course,
yeah.
if they want to go through PMA and get full approval, they're going to have to go through a significant raise, of course. But
Yeah, I think
the
you hit the nail on the spot, on the head.
but the
What's the description? Is the nail
you've hit the nail on the head.
the nail on the head? That's right. Yeah,
That's it. But I think these companies again, when you see Vericel, you see Nanocon, you see Hylex, you
yeah,
see Cytex. This is a space which is looking to grow, and there's a solution that's needed, and people have there's a market for it. I mean,